morning.
It is a lazy morning. People are just streaming in. I thought the sunshine would bring people out. But what is going on?
Sickness, lots and lots of sickness.
Oh, really? Sickness? Okay.
That's my guess.
Well, people are going to be streaming in as we get started here. For those of you who do not know me, if there's anyone who doesn't, I think everyone is looking familiar, but I am Sharon Tubbs. I am the Director of Health Visions Midwest, and we oversee the Allen County Health Equity Coalition. So thank you for streaming in and coming in for those of you who are in person today. We are so grateful to have you. We have a wonderful presentation that is coming up. If you've been to our meeting before, then you know that we are a faith-based organization. We don't want to offend anybody though, but we do want to begin our meetings with a short devotional or meditation. If that offends you, or if you'd rather not participate in that, then please feel free to turn your volume down for about 30 seconds. But for those of you who are that's okay with, you're into this, then I just had something short I wanted to share with you. This will be familiar to you. It is a hectic season, right? You can't tell it this morning because we're kind of laid back. But it is a hectic season. We're getting into the holiday season with Thanksgiving, although people are already putting out their Christmas decorations. I don't understand that, but if you do, then that's okay. Yeah, you've got your stuff already up, and that's fine. It's already in the stores, and everybody is ready. She has kids. Okay, everybody is ready for that. Here I want us to take in the information that is about to flow and to take in this time of partnership and collaboration and networking to just kind of chill for a second. Take this short moment of silence and think about this day. There's a familiar verse that says, "This is the day that the Lord has made." And I found a short commentary on it. It's very short. It says, "This is the day the Lord has made. Let us rejoice and be glad in it." So take just a couple of seconds to not think about the work that you have to do when you leave this place, but to just rejoice in this day. To just rejoice in this moment, in this time that we have together. And think about this. The beauty of the day is not that it is new, but that we are being made new. The glory of the day is not that it marks a change, but that we are being changed. With each day, with each hour, with each moment, we can be changed if we allow ourselves to bask in the newness of this day and the new things that it can bring to us and that we can bring to others. The blessing of the day is not that it is a day off, but that it is His day. Bless you. I hope you carry that with you to this day, and that when you get some new information, that you use that to see how it is changing us and how we can use that to change others. Okay? All right. Okay, so we've taken that on. The room has chilled. We have taken that pause time to appreciate this day and all that is to come. So we're going to take a look at our agenda. And so next on the agenda are our introductions. And so we want everybody to know who is in the room. Now, as I look around, we have a lot of familiar faces in the room. I think everybody is familiar. Maybe not. Maybe there are a few new ones. So we're going to go around. We're going to start virtually online, and we're going to introduce ourselves. Just want you to say your name, the organization you're with, not trying to put anybody on the spot. If you are new, if this is your first time here, or your first time here in a long time, let us know so we can give you a little hand clap for the newness, all right? So we're going to start online, and we're gonna begin with, I'm just gonna call people out by the names that I see in the order that I see them. And there's someone that says AADOAB, and I don't know who that is or what that means.
Mhm. Hi, I'm Audrey. I'm with the Allen County Department of Health.
Oh, okay, okay, you usually come in, okay, so I
Yes.
didn't, okay, I never saw the AADOAB. Okay, so she's not new. Hi there, Audrey, thanks for coming again. Cassandra.
Good morning, Cassandra with Stillwater Hospice.
Okay, Cassandra, thank you. Welcome. Mindy?
Good morning, Mindy Waldron. I'm the administrator of the Allen County Health Department.
Okay, thank you, Miss Mindy. She's not new. We know Mindy. Miss Meg?
Good morning, Meg Dissler with the St. Joe Community Health Foundation.
All right, Meg, we know. Meg is one of our grantors. Jan?
Good morning, Jan Moore from Community Nursing at Parkview Health.
Thank you, Jan. Melissa?
Melissa Martinez, Allen County Public Library.
Melissa's usually here too. She's staying in. Well, I don't know who's gonna eat our croissants. Carlos.
Hello, good morning. I'm Carlos, and I'm with Neighborhood Health.
All right. Hey, Carlos. Kelsey.
Hi, I'm Kelsey Owen. I'm over the nutrition programs with Aging and In-Home Services of Northeast Indiana.
Kelsey, have you been here before with us?
I haven't. I had scheduled to be there today, but my family and I are just getting over pneumonia. And so I did not want to spread any germs.
Thank you for staying away.
Thank you for that.
Especially since we have the health commissioner here.
Yeah, I figured you guys would forgive me. So
Let's clap for Kelsey. Thank you, Kelsey, for joining us. Kelsey is one of our partners too with the Hill Markets. Shelby.
Hi, I'm Shelby Van Bibber with Great Heights ABA.
Okay, Shelby. Shelby's been here before, right?
Yes.
Maria.
Hi, good morning. I'm Maria Hines with Indiana University School of Nursing.
We know Miss Maria. All right, and then that's JJ.
JJ Foster, Lake City Bank.
All right, Mr. Foster. Elka.
Hi, sorry, Grand Rising, everybody. Elka Jackson, Center for Nonviolence.
Okay, Elka was our presenter last month. Grand Rising to Miss Elka. Carla.
Okay. Hi, Carla Harrison with the Indiana Department of Health, Office of Minority Health.
Okay, thank you, Miss Carla. Ann. That Ann with CTN.
Good morning, Ann Hall with Community Transportation Network.
Celia, thank you, Ann.
Good morning, Celia Reyes, Community Engagement Specialist for MD Wise.
All right, and last but not least, Lily.
Hi, I'm Lily, Stop Suicide Northeast Indiana.
Okay, great, Lily. Good to see you. And now we'll go around the room real quick, starting here with Mr. Markley.
Good morning, I'm Jeff Markley with the Positive Resource Connections.
All right.
Good morning, Pat Turner with Tobacco Free Allen County.
All right.
Becky Hayes, Health Visions for Wayne.
Heather Essex, Racial Justice Coordinator for the YWCA.
Thank you, Heather.
Hi, Lupita Helvicios, bilingual community co-worker. Kelly Bauman with Associated Churches of Fort Wayne and Allen County.
Love it.
Julie Reese with Associated Churches of Fort Wayne and Allen County. And also the program that I work with is Journey Beside Mothers.
Okay, love it.
I'm Pamela Cash Dollar with Mental Health America.
Okay. Now, Pam, have you been here before?
Yes.
Yeah, it's been a long time.
No, I'm just saying. I said, well, if you haven't been here in a long time.
It hasn't been that long.
In a while.
But I was here back in like the early days because I worked in the health department when we did the clinics.
Yes.
Well, we're going to give Pam a hand. Thank you, Pam, for Mental Health America. Cassius Solomon, Hello Health Visions Midwest of Fort Wayne. I know, right?
Cassius Cash Dollar.
Okay. We'll get to Dr. Gutwein in a second.
Brenda Hoffman, Christian Community Healthcare.
Okay.
Austin Bradmitter, Executive Director of Christian Community Healthcare. First time.
This is first time.
Is this okay?
Advocate Health Business Midwest.
Felicia Say, Health Business Midwest.
All right. Anybody else that I'm missing?
Oh, we had one more come online, Tamisha Fikes.
Okay, Tamisha made it. Yes. Hi, Tamisha. We're just introducing ourselves. Say who you are and where you are from, who you're representing. Tamisha's audio is not seeming to work.
Yeah, I don't think it's connected.
Okay, so Tamisha, we saw and met Tamisha yesterday, actually, at the United Front event, and she was on stage. She was a panelist, and I invited her to come and look in and peek in on us. She is Tamisha Fight. She's with Midwest America Federal Credit Union. Okay, all right. Thanks, Tamisha. All right. So here we go. We have a presentation today. I won't take up a lot of time. Before we get to that, we have the pleasure of welcoming our Allen County Health Commissioner, Dr. Thomas Gutwein. Dr. Gutwein has been our health commissioner, and I don't have the exact date. When did you start here?
Just July of last year.
Oh,
So-
just 1 year ago. Okay, so he's been
a year and a half.
1 year ago, and he has come in with a bang. So Dr. Gutwein has been very supportive and come to a number of different events, not only to gather information and to learn from organizations that are serving underserved communities, but also to feed in and to pour in and to support. So we are very grateful for Dr. Gutwein's leadership. And I asked him to come today after some, asking around, who should we end the year with for our ACHEC meeting? I was like, who would be a good year ender, right? And the first suggestion that I got was for somebody from Allen County Health Department to come and talk about COVID. We have not gotten rid of COVID. We won't get rid of COVID, is what I've been told. Oh, he's shaking his head. But we have heard about a resurgence of COVID. We've heard more things about COVID coming back. And so as organizations that pour into people in our communities who are underserved, we want to know these types of, we want to know the status where we are so that we can better take care of ourselves in terms of self-care, and so that we can better serve the people that we are engaged to serve. So Dr. Gutwein, we look forward to hearing what you have to say today. If you would come on up, without further ado, everybody give a hand clap for our
Well, thank you, Sharon, for that introduction. And thank you, Felicia, for setting things up today. So yeah, as Sharon said, I'm Tom Gutwein, and I work in medicine. I've been in medicine here in the community for 30 years. I've lived in Fort Wayne since 1993 when I moved to Fort Wayne. I grew up in a small town in Indiana, just 1,000 people, so very small, about 100 miles away. So I'm lucky to be here in Fort Wayne, and I really enjoy what's going on. I think organizations like this make Fort Wayne a really great community. And I appreciate the fact that you guys are just getting together to talk about things and see where we can improve things and see how we can make things better for the whole community. My goal as health commissioner for Allen County is to make everybody in Allen County healthier, whatever it's going to take, and we have a lot of work to do. But fortunately, we have a lot of great partners. So I put together today, Sharon asked me just to talk a little bit about COVID. I think that we've talked about COVID a lot, and people are kind of tired of it maybe, but I think that I'm going to just share a little bit of data and a little bit of my thoughts on what we can do. Let me try. Is that okay if I share?
Yeah.
See if I can make this work. All right. So moving. Go ahead. Sorry. Can you see that okay?
I think it might be an accident.
Yes, we can see it.
Okay, great, thanks. So So in Allen County, what happened? So this has been kind of a 3-year journey, almost a little over 3-year journey. And when in March of 2020, when the outbreak started, it was a total disaster from the standpoint of what we knew and what we didn't know and how we were prepared. And one of the things that we want to learn from COVID is that we know if we look forward to the next 20 years, there's probably going to be something similar to this happen in the next 20 years. Just because people travel across the country every day, across the world every day, we have thousands and thousands of people that travel from every country in the world to the United States or out from the United States out to these countries and back again. So with all this international trade, international travel, you have cargo ships coming across the ocean every day. All that kind of stuff is bringing diseases and things like that to this country. So we know that this is probably going to occur sometime. I don't know if it's going to be 5 years, 10 years, or 20 years. But I think that the things that I wanted to, COVID, there was a lot of negative things about COVID. And I think that, I got to make sure I don't talk until like 11 o'clock or something. What time are you supposed to be done?
You just go on and
I'll talk.
when you see me walking up, that's your cue.
So really the scary thing with COVID was that it came on, it was brand new, we had no information. The mortality initially was incredibly high. We didn't know how to treat these people. As a physician, we were learning every day, trying to get more information on what we needed to do and how we would manage these patients. They had strange symptoms. A lot of them died right away. I can remember patients that came into the emergency department and died within 2 to 3 hours. And then there's other people that sat on the ventilator in the ICU for months. And those are really, really difficult situations for the families. And then we tried to figure out who's going to be most susceptible. Why do you have a family, and I would see this frequently, where you would have a husband and a wife, and then maybe the wife would get sick with COVID and she may pass away, but the husband never really had any symptoms. How can you explain that? I think it's all really difficult. And then there was a lot of people, because we didn't really know what the facts were, there was a lot of people putting a lot of information out there on what they thought may be or could be or should be done. So just tons of that. So the current state, so bringing us up to where we're at today, I think we've filtered out tons and tons of information. We have much better data today on effectiveness of different treatments and what we can do. And we know that, like, even though some people still wear like a bandana mask, that does nothing. So a bandana mask does not help, but we thought it might. We spent, we had, I don't know how many, probably 50 to 100 volunteers making cloth masks when this came out, because we had no PPE. So now we also know about transmission prevention measures, and then what's the susceptible population. So just an update on where we're at today. This data, I believe, is as of probably November the 8th. Some of this is the end of October, some of it is November 8th, and some of it like as far as the 12th. But 6.44 patients per week with COVID, and that's about 250 patients in Indiana. This is our region. So this is the most, this is like as of last week. So we are not as high as we are a little bit to the south and then farther south. So we're not as high. Just to show you where we're at. And then we look at emergency department visits for those patients that have COVID-like illness per 10,000 residents. And we are fairly high with that. So that's 7.64. So that's 350, 400 visits. And that's what we have documented that we collect through the CDC and the Department of Health. So how many new cases a day? And this is, we average 26 new cases, so we have a fair amount, but some of this is population based. So you can see that Marion County is going to have a lot more than Allen County, but we still have a fair number of cases. We still have new cases every day of COVID. And so who gets COVID, and who are we going to worry about, and who are we not going to worry about? What we do, another thing I wanted to show you with COVID is that we do monitor the wastewater in all of these regions. All these dots in Indiana, the ones that are black dots, those are areas where wastewater is monitored for the amount of COVID virus in the water. And we were hoping that this would be a little more of a predictive model. So maybe the wastewater COVID virus would go up a week or two before we might have a surge. But most of the recent data shows that it really kind of runs along with the cycle. So the higher the wastewater concentration, the higher the number of COVID cases. And it's been fairly, you can see a little bit of a couple surges or increases here, and then now we're kind of back up to this level again. So when we say that we have a little bit of a COVID surge, we do have more COVID in the community today than we did 2 months ago, and that's definitely something we have to keep an eye on. And then these red sections in Indiana are where COVID is actually increasing in the wastewater, and the blue sections are it's decreasing. And if you remember the bottom Cincinnati type southeast area of Indiana had a higher level of COVID patients today, but their wastewater is actually decreasing. So there may be a little bit of a predictive value, but not a lot. That's okay. So this is a beautiful green, almost all green map. And last year this was almost all red. And so we're happy that this is a number of new hospital admissions. So this is related to the people. We look at the people that are going to the hospital, that are admitted to the hospital, and we look at the number of cases in the community. And the reason we look at the number of cases in the hospital is because that is what really drove our concern 2 to 3 years ago when we had to shut down the community as far as serve offices and things like that, because it overwhelms the resources in the community for hospitalization. So today we're all green and almost all green in Indiana. So we have adequate resources. We don't have a lot of people hospitalized for COVID, which is great. And then this map we're yellow here, and this is the percent positivity. So we're between 10 and 15% positivity. So that just means that we're getting a fair number of people that are testing positive. If that number is less than 5%, then we're 100% in the green, and we don't have anything really to worry about. That's a very low level. And actually, the other part of that is when it's less than 5%, and you get a lot of the over-the-counter tests, it makes those tests less reliable. So sometimes you can have false positives and with those tests. And so you always have to look at the prevalence of the disease in the community before you can determine if that on the positivity of a test and the reliability. So just looking at COVID, and the last data we had on the wastewater was through October 1st that I could find, and this was just Allen County. So we did monitor it here back in 20, but we've been monitoring it very regularly since August of 2022. These are all COVID cases in Allen County. And some of you have seen this before. I have another slide that I want you to kind of compare with, but these are the demographics of the cases in Allen County based on age. And so these are people less than 5 down to 80 plus. And you can see that if you look at the incidence, which is per 10,000 residents, I look at those numbers, and it's anywhere between 3,000 to 4,000. It's very prevalent in the 18 to 35-year-old, 40-year-old people. There's a lot of COVID there. There's a fair amount of COVID, not quite as much per person, but still a fair amount. And I call these people are like the carriers that carry it around, the little kids, and they run it around, and it doesn't really bother them very much, and they share it. I got COVID from my grandson. Everybody, that kind of thing. It doesn't bother him near as much. And then these people are the people that are at work, that are sharing it at work. So they need to focus on staying home because they're going to spread this disease to other people. And then these people are the people that suffer the biggest consequences of COVID. And I think when you look at this graph, it really points it out. These are the deaths. So you can see that the distribution before are the people that got it. There were a lot of people in the 40-year-old age group, but there's not a lot of 40-year-olds per 10,000 that died. But when you look at the recipients of this, the 65, 75, and especially the 80 plus are the people that have a really difficult time managing COVID. Why is that? That's just because of the disease process in their body, their ability to fight it, mount an immune response, and their ability to fight off COVID. So those are the highest risk populations for COVID. And then these are deaths in Allen County by race. And so we had 12 deaths in the Asian category, 122 in the Black or African American, and then 174 were others, and then 939, which is actually fairly close to our demographics. If you look at the percentage of different races in Allen County. So it's not a long ways away from what we would have expected.
Is that this year or what's
This
the
is
time
all
frame?
overall.
Okay.
Overall. Yep, since 2020. Yep, yep. So we've had about 1,300 deaths in Allen County from COVID overall. That number was like 1,250 or 1,230 a year ago. I think when I took over, it was like 1,228, and it's probably been about 50 to 75 more people. We get average about one a week still, about one person a week. So overall. So just to make sure everybody's up to speed on what we should be thinking about, what we should be telling the community, anybody over the age of 6 months should get an updated COVID vaccine. So you remember we had the initial COVID vaccines, and then we had a bivalent COVID vaccine, and now we're calling it the updated COVID vaccine. So the updated COVID vaccine replaces everything else. And honestly, if you haven't gotten an updated vaccine, I'm not certain that you would consider yourself fully immunized, and I don't think that you probably could. If you had an initial vaccine 2 years ago, we know that that vaccine's effectiveness after 18 months is very, very low. So as I pointed out, there's no original or bivalent anymore. It's only updated. If you had COVID recently in 3 months, in about the last 90 days, you can wait to get another vaccine. And then who needs to get a COVID vaccine? You know, you saw who was impacted the most with the deaths by COVID. And those people that have any difficulty with their lungs, with COPD, maybe they have cerebral palsy, maybe they have MS, if they're smokers, that actually puts you at a higher risk also. So anything like that, and then certainly age, because as we age, our body just doesn't do the same thing at 70 that it did when you were 20. Your lungs don't work as well, filter things as well, and so that disease sets up in there, and then you run into trouble there. So that's a big problem. The other thing, right after you've had COVID, you're less likely to get it, but you can get it again, absolutely. So you should consider your personal risk of severe disease, or if you're with someone, if you live with someone who is immunocompromised, maybe a cancer patient, somebody that's on chemotherapy, then you really want to be considerate and looking out for them, because you can carry that virus more easily. And if you don't have a vaccine, then you'll probably carry a higher load of the virus than you would otherwise. And the vaccine does cover the most current variant. So where can you get a vaccine? So I just put a map together in Fort Wayne. These are all the places predominantly. So I would definitely, Super Shot's a great thing in our community. And Super Shot does have the vaccine. You can get it there for either free or $15. If you have insurance, then they'll take your insurance card. But that's a resource to our community, and their new office, or their office is on Lake and Hobson. And so anybody can go in there and get it. They also do mobile clinics to schools and things like that, which are very helpful. And I think if you have an organization that wants them to come to your organization to do some shots, I would reach out to Super Shot. They've been very open to helping this community any way they can. And if you go in there and look, they have a list of different places they're visiting each week. So they have the ability to be mobile and to go out and deliver these shots. And then the health department, we have some of these too. It's difficult. So some of the new COVID vaccine is a little bit in short supply, and not everyone has it. So I would encourage you to call. But we do have it at the health department too, in New Haven, at our medical annex. And then most of the time, your family physician's office can do that. They're probably the least available, the family physician's offices. But the pharmacies, they readily have it available, so you can make an appointment there. And then other mobile clinics, there's a couple other organizations that do some mobile clinics, which is really good, and some of them are out and about in the community also. I wanted to show this slide just to, this is, it almost, like if you look at it really close, it looks like it's 3D, but it's not. So just to explain this slide, so the bottom left, this is the percent of people that had one dose of vaccination. And these are the social vulnerability index. So those people that are socially vulnerable are in the far right hand, as you can see, and those people that are less vulnerable are over here. People that have housing and people that have food and those types of things, as you all know. So if you're in the white down here, you're less vulnerable, but you didn't get a vaccine. And if you're purple, you got a vaccine, but you're very, very vulnerable. So that's important. And you can see a lot of this in Arizona, maybe around the Indian reservations, things like that. are there. Allen County is actually this color here. You can't, I didn't blow it up enough, but just to show it all, but it's this color right here. So we did a, 61%. And not really great. Would have been much better to see that number 75, 85, but the population that had at least one dose of vaccine was 61. And again, these numbers, we don't have data on the new updated COVID vaccine, so this is on the bivalent or the original vaccine. But we did do a fairly good job. We have a fair amount of social vulnerable people, but I think we also did 50 to 64% in that range group. So certainly a lot of opportunity for improvement there. And then, I forgot about these. So I don't want to talk, I think it's important to know about COVID, but I think that like the gal that was on the line that was sick with pneumonia at home, it's important to realize that COVID is not the only bad virus out there. There's a lot of other things. And we all go to the doctor because we get sick and we feel bad and we want to test to see what specific virus do I have. Do I have flu, or do I have COVID, or do I have RSV? Those are the three that we test most frequently for. But there's also a lot of other diseases. Adenovirus. And then these are influenza, but adenovirus is the red line down here. And then there's this thing called human metapneumovirus. And that's very difficult. And human rhinovirus and enterovirus is this blue. So you can see that there's rhinovirus is very prevalent, and it's out there all the time, but we don't test for it very often. This data is national data, and there is a test you can do, but it's like $1,000, and you can do a swab, and you can check for 20 different viruses. But it doesn't matter if somebody has rhinovirus because we have no treatment, we have no vaccine, so it's all supportive care. So go to your pharmacy or go get some medication to get your comfort and stay home. Don't spread it. Wash your hands, clean your stuff in the house, clean the doorknobs, but you can't do anything necessarily about this. Does it kill people? Probably a few in the in the elderly or difficult people that are what we call vulnerable from a medical perspective. It does, but it's also something that's out there that people should just realize not everything's COVID, not everything's flu, not everything's RSV. And then we can also monitor this on a pretty regular basis. And if you look at the purple, I'll point this out later, but the purple is kind of starting to go up, which is RSV. This is just COVID nationwide, so currently 6.6% prevalence. So this is the same testing company that did this. It's called BioFire, but they do this testing and it's used across the country at lots and lots of hospitals. But typically on sicker people because, like I said, it costs like $1,000. So they monitor that, and you can see the prevalence there of COVID, how it was really high, and now it's not as much. This is RSV, and if you remember last year, we had a pretty bad RSV season. So the little kids are going to be really vulnerable here, and then older adults. I think there's somewhere around 7,000 or 8,000 people in the United States die each year from RSV, adults. So that's not something we don't worry about at all. And then what I'm kind of a little concerned about is this curve over here, because that's as of Friday. So you will see RSV. This is not our community, okay? There's no data specific to our community that would tell me that there's a huge surge of RSV, but I would venture to say typically what we'll see is within 2 weeks, we'll be right into that curve. It'll take us about 2 weeks for stuff to come from the West Coast or the East Coast to the Midwest. Sometimes it starts in the South. Flu usually starts more in the South and then comes up. And then this is where we're at with just the four, what I call the meaner viruses, the RSV that we talked a little bit about, the rhinovirus we talked about, which is the big blue, and then the COVID, which is, kind of waxing and waning also, and then adenovirus. Adenovirus causes a lot of prolonged symptoms in kids as far as watery eyes, runny nose, and it's just something that doesn't go away in 2 days. It just can be there for 10 days to 2 weeks, and it's really makes them uncomfortable and irritated. Again, not that I'm not aware of any vaccine, and there's no specific treatment. It's just supportive care. So isolation. So what do we do about COVID? The first thing I said, we can get a vaccine if you're vulnerable or if you're working around vulnerable people. Number two is isolate yourself if you do get sick. And that's really important to do. How long do you isolate? Now we still recommend a minimum of 5 days, and then wear a mask beyond that. Do you not go anywhere? If you have to go out or you need to go out or you feel like you have to, then you should wear a mask. For you, wear a mask for other people. If you have moderate symptoms, sometimes you may need to isolate for 10 days, and certainly you can do retesting. And then if you're severely immunocompromised, it's going to take your body longer to get rid of that viral load, we call it, and so you'll need to isolate for a longer period of time. But those people are usually chronically ill with other diseases. And then long COVID, this is another reason why I would, probably my number 2 or number 3 reason why people should get a vaccine. Because we do know that long COVID can be reduced by a vaccine. And people that have long COVID, it's a miserable thing. It can last up to 18 to 24 months, somewhere in that range. And 1 in 10 to 1 in 20 people that get COVID will get long COVID. They live in a brain fog. They have a fog for 6 months, 6 weeks, longer periods of time. It's a miserable type of thing. And there's a lot of studying going on with this right now, looking into this. But I think there may be some indicators we can find in the blood that when we've been looking at some samples. But we don't have a great way to diagnose it today other than symptomatic. It's kind of like a concussion. I mean, honestly, these people are like they had a concussion, like 3 head injuries, and now they're in a fog, and they feel terrible. So to prevent I wouldn't say to prevent long COVID, but to decrease the chance of you getting long COVID, I think a vaccine is helpful. I think that this slide I put in because I want to know, we have a lot of things going on in the health department right now. It's a great time to be involved with the health department. We've got a lot of projects that are going forth in our community over the next couple of years that are really, I think, going to be what I like to say, move the needle. We need to move the needle in this community, and we can't just sit stagnant. We need to move forward. And what can we do to move forward? And I think we've got an opportunity now through some additional funding that the state has given us to enhance a lot of programs that are going on in Allen County. As I mentioned, Allen County has a ton of great organizations, and they're doing some great things. So we're going to help perpetuate those or move those organizations further forward to fill in gaps where we know that there's gaps in our community. We know there's kids out there that aren't getting either like meals that they need or exercise that they need or health visits that they need or vaccinations that they need. And then there's adults too. So there's a whole gamut of people. And we're trying to figure out where that is who's most susceptible and where our gaps are in the community and how we can fill those gaps in. So that's what we're really working hard. And I think I can't say, I wouldn't be here today without Mindy. Mindy is like a rock star. I hate that word, but anyway, Mindy's a star, and she is wonderful. And so I say hats off to Mindy every day that I can come in here, and I appreciate that. Appreciate what she does. So that's what I had, and I'm more than willing to take questions or good questions, hard questions, easy questions. I am short, yeah.
I have a question. Can you talk about maybe how minorities being tested for long COVID in our community, like what does that look like? Because my understanding is that there actually early on wasn't a lot of data from minority.
I don't know what percent of, when I looked at the long COVID, I couldn't find, and you may have different information than I have because there's a lot of information out there. I didn't have specific differences amongst minorities. It was mostly broken down into age groups. And it was found to be that it was really across the spectrum, maybe a little bit in the older people, like the 8% and down to the 4% in the younger people, but it never saw anything that broke it down into minorities. I know that, I think that long COVID is something that we, as a community, we need to have a resource for those people. And I think that because it's something that's hard to understand, it's hard to deal with, it's like, why can't I go to work and do what I did 2 months ago? And why am I still feeling like this? So that's something that we need to make sure that anybody that has those types of symptoms is able to get checked out. And I think that what we could do would be to make sure that we do targeted education on on that disease process to those people working in clinics that are serving the minority.
If there's a way that I can help with that, please let me know, because I had COVID and I had COVID on my 40th birthday, so never mind that. The symptoms weren't bad. It was the long COVID, and then for my medical provider, I just felt like she was super dismissive of including me in long COVID testing. So it felt like I basically suffered that fog by myself, and like it's hard to explain. So if there's a way that I can mediate that in our community, I would be more than willing to help.
Yeah, absolutely. I will do that. I will. So I've done some, I've had some conversation, I should say, with Dr. Chung Lee at the IU Med Center, has done some research on this and is very up to date and has a clinic. But he also, I can work with him to put some education together and then get that out to the community providers, because that's where I think that's part of where the gap is.
We do have some questions coming in online, and so one of the questions asked, you were saying something about masks earlier. Can you circle back to that and talk about the most to least effective mask to wear?
Yeah, so the most effective mask to wear is a mask that's an N95 mask that has a filter. It's usually a duckbill. You see, it's a white thing. That is the most effective and does a wonderful job. You should feel very safe wearing those. That's where I would wear when I take care of a patient that has COVID, that's coughing all over you and all that kind of stuff. You just put that mask on and you're going to be okay. But you also need to wash your hands as soon as you do that. And if you take the mask off, you need to wash your hands because you just touched the dirty mask. The second masks are just the paper masks that people wear. They're kind of like called a surgical mask, and they might be yellow or blue, but they're paper. They don't give as tight of a seal. They're effective in probably just guesstimating like 95, 97% of the time. So you should feel pretty safe if you're not actively being coughed on and working in an environment where you know there's COVID people. So you could wear this mask in public and feel good. But the cloth masks they found are no different than not wearing a mask at all. The bandanas, they keep the dust out, but the COVID particles get through. They do work great if you're like on an ATV or something.
And then another question says, other than testing, is there a way to know the difference between a regular old cold and one of the viruses that you just talked about?
No, not reliably. There's probably a lot of old wives' tales about things, but no. Either one, you take chicken, you eat some chicken noodle soup, and some Tylenol or Motrin, and rest in bed and stay home and wash your hands.
For RSV, and there was another virus that you mentioned that affects children. I forget. I think it started with an A.
The adenovirus.
Okay.
Yep.
Are there vaccines for those?
RSV, there's a new vaccine.
Okay.
That's the exciting thing about RSV, is that we do have a vaccine now. So this is really, really important. Okay, this is a game changer. Pregnant moms, 32 to 36 weeks, need to get that vaccine. That will protect their unborn child, and it'll protect their child up until they're about 18 months old. So that is the most effective thing to do. Pregnant moms, 32 to 36 weeks old, should get an RSV vaccine. Very safe and very good for the child. If they don't get that vaccine when they're 32 to 36 weeks and the child's born, then their child can get a vaccine within the first week. Those are not, that vaccine is more in short supply. So that's a little bit of a supply issue today. I know that when I checked around, that's hard to get. So family docs, pediatricians might have a hard time doing that. So the best thing you can do is have all of your moms 32 to 36 weeks get an RSV vaccine. And then there's a different vaccine for older people over the age of 50 or 55, but it really depends on your health conditions, if you have a lot of disease problems. I probably won't get one. I'm over 50, but I probably won't get one today. But if I was 75, or if I smoked a lot, or if I had lung conditions, I was a coal miner, I worked outside a lot, around a lot of dust, and my lungs were not perfect, they're not perfect, I know that. But my lungs were not good, then I would get a vaccine.
Are those free, those vaccines, those RSV?
Super Shot has those vaccines.
Okay.
And that's the one place that I know has those, and that's the most cost-effective place to get it.
I'm wondering if Neighborhood Health has those. Carlos is on the line. We can
Carlos,
ask
do
him.
you know if they have them in Neighborhood Health?
He's going to type some stuff in the chat. We'll see what Carlos says as he investigates that.
Sorry, there is another question in the chat. Is there anything that can be done to reduce the effects of long COVID? For example, if someone has lost their sense of smell for 6 months to a year.
No. There is a new drug that's in Japan that is being tested to prevent, that'll help those people that lost their sense of smell, but it's not on the market today.
Are the OB offices offering it to the?
They should be. As far as I know, yes, and we're seeing people that are getting it. It's really today, because it's so new, it's an availability issue, supply chain issue. We've heard that before.
How effective is this new updated version of the COVID vaccine?
I would say the most effective. It's not going to prevent 100%. It'll always prevent the severity of disease that you get, and it'll decrease your chance of having long COVID. It will not keep you from getting COVID.
And when you said the updated version, when was it last updated? Because I got it
Just
in
in August.
February. Oh, so I missed the update.
Yeah, so this just came out in August. It's an update.
Okay, so are we thinking that every year we're gonna need to get new COVID updates and shots?
I think yes. I think you will see in the future updated COVID along with your updated flu.
All right.
So flu vaccines are another thing I didn't mention. A really effective way to decrease the amount of people with flu in the community. You know, you go out to a restaurant and just like when you had COVID, you worried about those people coughing next to you. One of those people probably in about a month, I would guess by Christmas, we'll have influenza here. I don't think we'll have it here next week, and I don't think it'll be the week after. We haven't seen a lot of it in the United Kingdom yet, and we usually see it in the United Kingdom before it comes over to the United States. And then, as I said too, we see it more in the southern part of the United States before. So if you go to Florida, you'll probably see it in Orlando first. Orlando, think about all the people from around the world that go to Orlando. I mean, wonder why it starts there.
Any other questions for Dr. Gutwein?
There's one more.
Okay.
Still about masks. About the cloth mask, even if they're double layered and made with 100% quilted cotton, are they at all effective?
If you had I would say yes, it's helpful. It's better to wear a cotton mask than to wear nothing. It may not keep all the COVID germs out, but it'll keep other germs out.
Okay.
Yeah, so that was just related to COVID. So other germs, maybe it may be helpful in keeping them.
Thank you.
And if it keeps you from touching touching the ketchup bottle in the store and then touching your mouth because your mask is there, then it did its job. Oh.
Elka has a supply of cloth masks. She wants to ensure that they are safe.
Here's the thing. Here's the thing, Sharon. I make them, and I love making them. I said the thing is that I make them, and I love making them, and I double layer them, and I use my quilting cotton, and they're so pretty. But if they're not effective, then I'll stop making them.
Very stylish.
Okay, just double layer them, put some stuff in there, Elka, you're good to go. All right, is this your phone? Okay.
Yeah, there you go.
Thank you so much, Dr. Gutwein. Thank you for that very informative presentation. I think that was a great addition to our year, to end the year with this information about COVID, flu, some other diseases that you said that I didn't even know about. So thank you so much. If you have any further questions,
Yeah,
can we
email me at the health department?
email him
Yeah.
at the health department. So we're going to move on with the rest of our agenda, which is basically we're going to do some neighbor sharing, some partner sharing. But we want to tell you a couple of things about Allen County Health Equity Coalition. For those who are here, you have a packet about our 2024 ACHEC membership, okay? For those of you who are online, we will get that to you. Do we have an online version?
Not yet.
Okay, because I just sent it to you 5 minutes before I just sent it for 5 minutes before the meeting. So yeah, we will send this to you, but basically, we want to let you know that it's time to renew your membership to ACHEC. We want to let you know about some of the exciting things real quick that we've got coming up in 2024. Basically, we want to do some different things in 2024. We are going to have some practical skills training sessions available. This year, we had some lunch and learns about health equity. Next year, Health Visions is going to be doing a course that, I don't want to spoil I don't want to spoil it, and plus I don't have all the information. But we'll talk to you a little bit about that later on. But for ACHEC, we're going to be doing some training sessions that will build up our organizations, build up you guys with skills so that you can better serve the community. So we're going to do that, and that goes in your membership. So that's part of your membership. So that's one of the perks that you get. We're going to have a survey that is going to be sent out to you, or that you can fill in. Felicia's got the scanning thing, what is it called? The QR code, yes. She's got the QR code that you can scan. You can take that survey. It's a short survey, but it's going to give us an idea of some of the things that would be helpful to you. And some of the things that we're doing is going to tell us, is this helpful? Like our news and events that you get every other week. Are y'all reading those? We want to see, because Felicia's putting some time into those. And so we want to make sure that the things that we're doing are helpful, and we want to hear from you about any other things that may be helpful for the coalition. So it is coalition membership time in 2024. Here is the packet that tells you all the great things that you can get. It has our meeting schedule. Some of those dates may change depending on the skills and the training sections that we're going to offer. And then next month, we have our holiday soiree, although it's not really a soiree, it's going to be at lunchtime, but it's that word. So we want you to know about that. First of all, scan that so that you'll be able to do the survey. There are some hard copies for those of you who do we have hard copies?
No, but I can print them. But this that I just showed was actually to RSVP to the
Oh, there you go. Yeah, oh, thank you. She's moving right along. She's quicker than I am. So this is the holiday soiree. You can scan to register for the soiree. That's December 15th. So this is the first time we're doing this. This is a celebration time for ACHEC, for all of our members. And we're going to have some clients there, but we're going to have a nice lunch. We're going to, it's going to be hot and popping, as the young folks say. We're going to have that. We're going to have an inspirational talk by me. And so I've got some words of inspiration and some things that we want to look forward to for 2024 and some things that we can look back on for 2023. So please come. It's going to be at the library December 15th, 12 o'clock noon. We're going to have it all cute and decorated. So we want you to be there. This is our celebration and appreciation for you as our ACHEC members. Register today, please. Good food awaits you and a good time. And so anyway, that is also going to be part of your membership for next year. So these are some of the perks that you get. What am I leaving out, Felicia?
I don't think so.
Okay. Okay, so you're going to read this packet. You're going to see all the things that are available for you. And you're going to be able to send in your membership fee, and the membership fee and dues are due January 12th. So we're giving you a couple of months. They're due January 12th. Those are effective through the 31st. And what are you paying for? Well, we are an organization that is funded, grant funded, private donations, and partially through the Poor Handmaids of Jesus Christ. But all of our funding, most of our funding, is allocated toward programs, okay? So this is something extra that we do. So your fees pay for staff time, probably not all of the staff time, but a piece of the staff time that is spent here. It pays for the events that we're putting together and the wonderful croissants that we give each month, and juice and coffee, okay? So any questions about ACHEC membership renewal? January 12th, that is ready for you. And then you see on your agenda that we have some updates for things that are coming up. Tomorrow, Cassius, what's happening tomorrow?
Tomorrow, Together for Tomorrow. Dr. Lauren Dundee-Puntres and Joanne Mortori will be on the call talking about infant mortality and maternal mortality, as it is still prevalent in today, very serious, and we're gonna have the information shared. But I've also asked, Julie will be on the call, hopefully sharing about genocide mothers and some other organizations just to share what do we do to come around these mothers as well and these infants. So yeah, it's exciting. Tune in, register. It's at noon online, so you don't have to leave your offices. All of you online who like to stay in your office, come on, come on.
All right, so there you are. Thank you, Cassius. That will be a wonderful and informative program. And then we've got Thriving Thursdays that are 2 Thursdays out of the month. The next one is November 3rd. You can invite your clients to come. You can come learn about various chronic conditions and issues affecting underserved populations. And of course, we always provide, not always, but we provide interpretation and translation for Spanish speakers in the community through Lupita as her schedule permits. So that's medical interpretation, sometimes practical needs that clients need fulfilled. Please contact us and Lupita will see how that fits into the schedule and what we do. Now, it is time for our partner sharing. We have some time for that. Anyone want to share something that's going on with your organization? Okay, Heather.
My name is Heather Essex Guy, again, with the YWCA. So we have had a Diversity 101 program. I've revamped it. It's less of a vocabulary lesson and more of like self-reflection, and also talking about tools for allyship. So leaving people with tools on how to actually incorporate some of what we learn. So I'd like to offer that to you, your organizations. It's free. My presentation itself probably would only take an hour, but discussion maybe might add some time. But again, it's a free program if anyone's interested in doing some racial literacy learning.
Awesome, that is much needed. Thank you, Heather, and the YWCA. They have done a phenomenal job throughout the year with diversity dialogues and various sessions. So this allyship pilot that you're doing, I'm looking forward to it. I cannot attend that particular Saturday, but I'm looking forward to attending the next one. So please take advantage of that with the YWCA. Who else? Yes.
So a couple of exciting things happening over at Mental Health America. So for one, we are currently offering free trainings if anybody needs that. We have like QPR, we have mental health first aid, we have just like general mental health information. So anybody that wants that can either reach out to me directly or we have something on our website. But then super exciting is on Tuesdays, we now have some free support groups. So on Tuesday evening, the first and third Tuesdays, we have a free online depression and anxiety support group that meets, and it's being ran by our newer trainer, who's also a licensed mental health counselor. So far we've had we just started it, we've had nobody showing up, so if you show up, you might get a one-on-one session. But then on the opposite Tuesdays, we have a peer-led art support group now that's completely free. And it meets at PFW, and it's really very fun. My mom, who doesn't really ever put herself out there for anything, has been going and enjoying it and finding that it's a good fit. So all of that information is on our social media and website, but completely free for those.
Thank you, Pamela. That is some good stuff. Mental health first aid, I will contact you because that's something that we want to get into.
It's such a long training. It's really, really difficult for most people to give up that much time. But
Well, that wasn't a
QPR
great selling point.
I know. I think a lot of people contact me and then are like, how long? Because it's a full day.
Right.
So it makes it hard for a lot of organizations.
Yeah.
We can split it into two, but like QPR, which is question, persuade, refer, is only about an hour and a half.
Yes, okay, great stuff going on at Mental Health America. Anybody else? Yes.
Christian Community Healthcare is just starting a phase of growth for our organization. We're starting in second location in the heart of downtown. And we're a primary and urgent care facility for people regardless of insurance status or income. We don't restrict, we have no restrictions really. So people that just need access to a medical professional, they can walk in at any time and receive that care. We're still a long way away from that building, but we have some opportunity to start serving clients here in Fort Wayne, possibly in January. So as we start exploring this process, we just love to partner with any organization just to learn what the needs are as we come into the community so we can be effective in providing those needs. And then just working with other great organizations like yourselves to partner to bring better health to the community as well.
Thank you. Thank you so much. Good to hear about another opportunity for help. And anybody online? Go ahead.
I was gonna say, I do have, so Elka put in the chat that the Indiana Coalition Against Domestic Violence, who the Fort Wayne group does a lot with, is asking folks to please take the IDOH Health Needs Assessment Survey. It's quick and easy, and there's an opportunity to win $25.
And how do we take that survey?
There's a link in the chat, which I can send out to everyone in their emails. In the
Okay.
ACHEC News and Events.
There you go. Anyone else online?
No, not yet.
Did Carlos answer our question about the neighborhood health? Okay, he might have stepped away. But
Could I, just real quick, so Journey Beside Mothers, we have a weekly play group for moms and their preschool age children and down to infant. That takes place every Wednesday at the Mission House at Associated Churches from 1:30 to 3. We find that it's a great source for moms to get out amongst other moms and be supported. And we do fun things sometimes, and we sometimes do, have discussions. We just switch it up a lot, and the moms seem to appreciate it. They also have about a half-hour, 45-minute break from their children, because we do provide childcare. So anyway, just if you're, in groups with mothers with young children, every Wednesday, 1:30 to 3. It is a little, with holiday times and everything, we take some times off, but basically, yeah. And then you can contact me with any questions.
all right. And so, do you have like a flyer or something that we can put in the news and events? And so that people can.
So all of the mother support that we have is in this flyer. Basically, we also do mother mentoring. So if women need a support person to walk alongside them, we provide that. And we also offer a young mom gathering monthly for like teen moms to kind of come together and have, support, and just to be, there's childcare again, and
Right.
to be a teenager. And
Feel free to distribute that.
Okay, yes.
Yes. All right. Anybody
One
else?
more?
Yes.
Oh,
Two
go
more.
ahead.
Go ahead.
Well, I just wanted to add that this presentation was very timely because how I met Sharon was when Associated Churches hosted a registration site for vaccines, for the COVID vaccines specifically. So I just wanted to, bring that out.
We're
today.
full circle now. Yes, that was like, 2 or 3 years ago? 2 years ago, yes. All right. And
So we have something fun going on Thursday, November 30th. We're having a holiday Cinco event. You guys know Cinco?
No, what is
No.
that?
I didn't either. That's why I've got people on my board. So it is like bingo, but your bingo card, instead of it being numbers, it will be Christmas song titles. And then we'll be playing like a 30-second clip of a Christmas song. So when you hear Rudolph, you're looking for Rudolph the Red-Nosed Reindeer on your bingo card. And then when you win, you go Cinco instead of bingo.
bingo.
So yeah, it's a little fundraiser. So it's $25. November 30th from 6:30 to 8:30 out at the venue by Charlie's Place out on Wells Street. Yes, I have a flyer, which I could get to you if you want to share that with
Thank
everybody.
you.
It's just a fun, we did it this summer, we did an 80s rock, 80s pop singo, and people loved it so much, so we're gonna do it again.
It does sound like fun.
Everybody starts, as soon as the song starts, they start singing and
Who
dancing.
doesn't love Rudolph the Red-Nosed Reindeer?
Right.
Had a very shiny nose.
Yeah.
Jeff, is that all ages or?
Yeah.
Okay.
Yeah.
Any other news and events? All right, if there are not, then we will be released to do some networking and our croissants for people who are here. Sorry, people online, you cannot have one. But we want to wish everyone a very, very happy Thanksgiving. We are so grateful. Our gratefulness and thankfulness is for each of you and the work that you are putting forth and doing in this community to serve underserved groups. And I am very grateful for my team. Team, raise your hands. This is a powerful team, y'all. You gotta give it up for Help Business. Anyway, thank you so much for joining us, and we will see you all hopefully December 15th at the library for our holiday soiree in the afternoon with good food. Thank you.